Chairman, thank you. Secretary Kennedy, welcome. It's good to see you here again.
Good to see you, Senator Daines.
Since you were first nominated in this role, it's been your goal and the President's to make HHS the gold standard of science. I appreciate your sincere commitment to that goal and the role you're playing in restoring America's leadership in scientific rigor, transparency, and public health. And before I get into a more specific public health question, I just want to follow up on the exchange you just had about the rural health care in our country. And Montana, I think when you think Montana, you think rural. We love that about our state. But I want to build on what you just said, Mr. Secretary, because there was a transformative $50 billion investment that Senate Republicans made in working with the Trump administration to strengthen health care across rural America in our working family tax cut bill. This has been $50 billion. Following a competitive application process, Montana is receiving a $233 million investment from the Trump administration, the fourth highest funding award of all 50 states to stabilize and modernize rural health care delivery throughout the state. Mr. Secretary, could you touch for a moment on the real change this investment will have on rural health care access, delivery, and outcomes in places like Montana as well as across America?
Yeah, I mean, I would refer in my answer to the senator's criticism, the senator's hypothesis that some future cut in Medicaid is closing hospitals in her state. Right now, Medicaid pays about 7% in total to rural hospitals. It's about $20 billion a year to all the rural areas in our country. We have now increased the influx of federal dollars by an extra $10 billion a year. It's astronomical. It's a 50% rise in the money that rural hospitals are getting traditionally from Medicaid. So first of all, we're not cutting Medicaid, and they keep saying we are, but the Congressional Budget Office says we're raising it by 47%. And in addition to that, this fund is putting an unmatched flow of federal dollars into those hospitals, and, you know, President Trump cares. And all these hospitals are closing. We got to keep rural America alive, and you cannot do that without local health care.
Mr. Secretary, I met yesterday with our hospital administrators from across our state. They came in, CEOs came into my office, and we were talking about the enthusiasm, excitement they had about what's happening right now, as you just articulated. And the fact you're also going after the fraud that's occurring right now in these programs. The American people want the right people helped. They want the fraudsters removed, and I appreciate your leadership on that. And that's delivering real results and outcomes for the American people. Back on the issue of safety, I want to go back to my earlier comment, and I want to continue a conversation we had around what HHS is doing to apply the principles of safety for the American people as it relates to the federal regulations on Mifepristone. You've stated the FDA is conducting a comprehensive safety review, which they are, and I encourage you to see that review through completion, guided by the best available data. Some of the evidence we already have today points to some serious real-world consequence as it relates to safety for women. We know about the outcomes to the baby, but I'm talking about the outcomes now to women. In fact, there was analysis of over 865,000 Mifepristone prescriptions compiled from insurance claims, found that 11% of women experienced a serious adverse event. That typically means going to the ER, serious medical care required within 45 days of taking Mifepristone. That's 22 times higher than the FDA's longstanding estimate of less than 0.5%. In the first half of 2025, over 27%, in fact, of all abortions in the U.S. were chemical abortions provided by online clinics, and that number continues to grow. Given the fact there's a lot of disturbing data that already exists, will you implement interim safeguards as well as look at reinstating the in-person dispensing requirement until the full safety review is completed?
Regrettably, Senator Daines, I cannot comment on that because of the litigation. I've been advised by the Office of General Counsel not to talk about it.
Well, maybe I can use this platform.
I have read that study.
Right, and the actual adverse effects are 22 times what the FDA had on the label, and so we want to see action taken because women are being harmed by Mifepristone.
Thank you, Senator Warren.